Ballad health officials say the number of patients the health system's treating with COVID-19 continues to increase. Due to a rising number of local cases, Ballad Health has once again started releasing its weekly COVID-19 data reports. They sent the first one out on Friday, the first one we've seen in weeks. However, today Ballad Health told us those numbers continue to rise. As of today, 168 people are hospitalized due to COVID-19. Of those cases, 25 patients are in intensive care. That's 8 more than just on Friday. 9 patients in ICU are on ventilators. 4 pediatric patients at the Niswonger Children's Hospital have the virus, and Ashley Sharp is here with an update on this story. Ashley?
Well, Josh, Ballad's concern over rising hospitalized COVID-19 patients comes after the CDC on Thursday took a step back from certain COVID-19 restrictions for the vaccinated and unvaccinated alike. We're getting answers on how we should respond at this stage in the pandemic. Ballad Health saying our region is once again in the middle of a COVID surge driven by the BA.5 variant.
We don't see a significant drop in the next little bit, but we're hoping that maybe we can be kind of near the peak and plateau for a little bit before we come down.
168 people are hospitalized for COVID treatment today. Ballad hasn't seen numbers this high since March, with 172. Medical professionals stress at this stage in the pandemic, COVID vaccine boosters are needed.
So it's really important to understand, based on your age and your health factors, how many doses you need. And if you're not up to date, go get that.
This comes as Thursday, the CDC walked back several COVID guidelines, one being that quarantine is no longer recommended for people who are exposed to COVID.
It's really key to understand CDC is still saying if you are positive, you should isolate for 5 days at least. You should continue to mask for days 6 through 10.
The CDC also relaxed guidelines for school children, no longer recommending routine testing or quarantines for exposure. And they recommend mask wearing only if community transmission is deemed high.
The main thing for parents to consider and for people to consider in general is make sure your vaccination status is fully up to date.
Dr. Christina Johns, a pediatric emergency care physician, found the CDC guideline changes surprising.
The timing might not be exactly right.
She calls it a shift to individual responsibility and says for young children, especially with the start of the new school year, parents should consider the vaccine safe and the best line of defense. Dr. Johns encourages parents to seek advice from pediatricians and doctors about vaccinating their kids. She adds it's important to remember when your children are sick and not feeling well, even if you haven't gotten a positive COVID test back for them yet, it's best to keep them at home. Josh.